Hello again, Tim Spector of the Zoe COVID study giving this week's update. And it's a bit of a mixed picture, but the bottom line is we're around 19,000 new cases. That is gone up since last week with an overall R value of around 1.1. And this is broken down into most of those still coming from unvaccinated people, roughly 15,000 cases a day, with about 4,000 people a day getting infected who have had at least one or two shots of the vaccine. And the ray of sunshine, if you like, is when we look at the previous hotspots, the ones where we've been driving this real wave, have been in the northwest of the country of England and Scotland. We're seeing clear signs that they are running out of steam, which is good news. But other things are happening in the rest of the country. But let's have a breakdown of this positivity, as many of you have asked for, by vaccination status. And this is not exactly incidence, but it's very similar to it. The positivity in completely unvaccinated people last week was 2.7%, and in people who had one shot, this is 10 days after getting that first shot, it was down to 1%. So definitely better than being unvaccinated. But when you have had the two shots, your risk was down to, the number of people was 0.17%. So really low, and a 20-fold difference between those groups. This shows that vaccination really is working even against this nasty Delta variant. So let's now look at our vaccination map, and you can see how uptake is doing around the country, and we are seeing the highest rates of uptake in Wales, which is several weeks ahead of the rest of the country. So well done, Wales, and they've had a really good time in this in the last couple of months, not having many infections. Northwest doing pretty well despite the high numbers, but the lowest rates, slightly worrying, are still in London. Now, let's go back to the infection rates, and the gaps between the highest and lowest is still quite large, but is narrowing. And there are still more cases definitely in Scotland and northwest of England. But whereas many parts of the country are levelling off, we are seeing increases in some areas from a low base. London is one of them. We need to watch that. But I think you can see the southwest is a particular problem, particularly Cornwall, which has emerged for the first time really in the whole of this pandemic as showing up as a hotspot. We estimate around 260 cases per 100,000. And why all of a sudden would Cornwall suddenly appear out of nowhere and have higher rates than Bristol? Well, I think there are a number of reasons. We don't know for sure, but it's one of the top places that holidaymakers are going. It also coincided with half term and lots of mixing of families in relatively small spaces. The G7 summit, can't ignore that. Massive influx of people into a small, tiny area around St Ives where all of these infections are happening. Over 6,000 police drafted in from all over the country, 3,000 catering staff, etc., etc. But the other factor here is that it's still being driven by young people unvaccinated, and we know that places like Cornwall didn't have many infections, so a lot of the young population were unexposed to the virus, didn't have antibodies, and I think that's obviously another factor in this equation. So I think we need to be thinking whether we're going to be seeing similar outbreaks, hotspots occurring in other holiday destinations. I think this is quite likely. So we're going to keep a close eye, with your help, on places like Norfolk and the Lake District. But we need people there to monitor so we can get on top of it very early on. So the other thing we'll also be keeping an eye on is whether we're going to be seeing the shift from cities to countryside, where there might be more people who have not been exposed to the virus, and that's something we need to keep a very close eye on. So will we be seeing a shift from urban to rural areas because of the susceptibility of the population? Quite possibly. But there's no doubt that Delta variant has taken a grip on the country, with over 90% of cases estimated to have it. So let's now look at the context of the virus compared to our European neighbours. This really emphasises that it's probably more dangerous to travel to the northwest of the country, the Lake District or Scotland, than it might be to travel to Portugal or Spain. You can see from the graph that we are still at the top of the European league tables in terms of numbers of confirmed cases, and does make it hard to reconcile the current restrictions on people coming back from those countries, because they're coming back to areas that have many more cases than they're coming from. And I think the real risk of travel is probably being stuck on an aeroplane in very cramped conditions next to someone from the UK who probably might have the virus or an asymptomatic version, because they're not being tested before they get on the aeroplane. So that's definitely something to think about as we go forward, and hopefully restrictions are relaxed. Let's now look at deaths and hospitalizations, because Matt Hancock indicated this week that the signs are looking positive for total relaxation on the 19th of July. And you can see from this graph that the number of new cases, although it was dropping from January to March, is now rising still quite rapidly. Whereas over the same time period, we've seen around 200 daily hospitalizations and around 10 daily deaths over the last week. So nothing like the consequences that we had in the early part of the year. Compared to the number of cases, really very little NHS activity. And this is reassuring, because we can see that for complex reasons of the age of the population, vaccinations, etc., and possibly the variant, the disease is getting milder. And we need to compare this, for example, with seasonal flu, where we might expect around 11,000 deaths a year on an average time, and maybe 30 deaths a day. So it's really important always to think in the context of what would otherwise happen. And as I mentioned before, COVID is now endemic, and it's something we've all got to live with. Now, let's just talk about the symptoms. We're in a new phase of the virus, young, unvaccinated, no real problems of large deaths, but the symptoms are changing because of the circumstances, and we've got a new ranking of symptoms divided up whether you've had one or two vaccines. And this is a snapshot of what we're seeing in the last 30 days, so it will change a little bit from one report to another. But after 2 doses of the vaccine, headache is still number 1, runny nose number 2, sneezing, sore throat number 4. If you've had a single dose, it's pretty similar, except persistent cough comes in there at number 5. And if you've not had any vaccine, you're going to still get the headache, sore throat, runny nose. You're much more likely to get a fever, though, and a persistent cough at number 5. So things are a bit different depending on the vaccine. You can see how the vaccine is, in a way, preventing you getting more of the classical symptoms that you might have expected. And loss of smell is now down to number 8 in those unvaccinated, and this was previously around number 3 or 4 in our lists. And if you had a vaccine, really fever is not in the top 5. So absolutely do not rely on fever as an indicator of whether you are currently infected. So we're still working out whether this is due to the Delta virus or not, or whether this is just the circumstances. We'll have a future report on that as the team analyse the data. So if you are getting symptoms, however mild, do report them on the app, and you will get a free PCR test. But if there's any delay, do get a lateral flow one as well. And we do need to keep an eye on the top UK holiday destinations, so please do log in from wherever you are, and we need to also find out about what the latest symptoms are. Thanks for your amazing contributions. Thanks for logging. Please remember to like and subscribe. Hit the notification button if you'd like to be informed, and stay logging, stay safe.